Hello, RevDivers. Welcome back. We've been gone for a little bit this time. We've been dealing with a lot of policy stuff, haven't we, Kim?
Oh my gosh, there's been so many policies that have been updated.
Oh, I know. Final rule coding updates. We've got all kinds of crazy, great stuff coming to you guys in this next season of RevDive. And we're starting things off with Eric Demers. He is the CEO at Madaket, and we are super excited to talk to him today, you guys. He is very innovative. He is a visionary in this space. And we're really hoping to talk about automation and some really cool things we can do there. So, Eric, thank you so much for being on the show.
Happy to be here. Looking forward to having a discussion.
Oh, so are we. And I wanted to really kind of kick things off high level, but before we get there, could you tell us a little bit about Madaket Health and what you guys are doing?
Yeah, happy to. Yeah, so Madaket, we've been around in business for about 7 years now. Um, the reason we started the company was looking at just candidly administrative waste and challenges in the healthcare industry. I've been in that space my whole life, and obviously, I'm always trying to find ways to improve, make the industry a little bit better. And when we look at the opportunities in the industry, we focus on more of the provider data side of the business and all of the business and administrative functions that they have to do both internally and externally in order to just kind of be in business. And a lot of that is really rooted in a lot of manual and service labor, which from our perspective is somewhat unnecessary. So our whole goal has been in order to put automation in place to help relieve the stress on those organizations, make it more efficient and more effective for them going forward. So that's really what our goal is, our mission is at Madaket.
So let's kick things off and let's talk a little bit about the intersection of technology and healthcare management. There's sometimes that Kim and I go into organizations and they're still on paper charts. Or we have a kind of the pendulum swing. We have organizations we go to that say, yeah, we have 4 different EHRs and we've got 5 practice management systems. And then we've got 2 places where we do our credentialing software. And we've got to find a balance, right? Where do you kind of see that intersection of technology and healthcare management?
Yeah, so I've always been a firm believer, being in tech a long time, that technology is an enablement. It's not necessarily supposed to be just the process itself, right? So from a organizational perspective, a lot of what we focus on is how do we meet the end user where they are and where they're comfortable. And I think that's the biggest opportunity that we look at when we go into organizations. We see everything you just mentioned, right? We lots of times we walk in and we're helping them move from a truly manual paper-based process to automation, and that is it's a different style, different everything for them, but allows them to scale, right? And something they can do without adding more people and actually get more throughput. So it's an exciting opportunity for them, but stressful for a lot of organizations to make that journey. And then we go to other organizations where they're much larger, probably enterprise. Maybe they've acquired additional practices or businesses over time. And in typical fashion, they didn't replace anything. So they're running a lot of disparate products, services, and systems all in the same organization. And it's an opportunity to really streamline those, right? How do you move them all to one platform, make it more simplistic, give a holistic view of the organization? So I think when we look at technology and kind of an intersection point, it's really understanding what your client needs in order for them to take that step forward.
Oh my gosh. So, that really resonates with us when we talk about client needs, right? There are every organization is unique and their workflows are unique. Their geographic
Mhm.
location is unique. Their patient population is unique. Their staff needs are unique, right? And looking at automation, there are pros and cons to automation. I mean, there's especially when it comes to
Mhm.
provider data management, right? There are some processes that are manual that we might want to keep manual, right? But then there are other processes, when they are not automated, it inhibits the staff experience, the work, your workforce experience.
Mhm.
It definitely reduces efficiencies. So, from your perspective, what are the kind of pros and cons of automation of provider data management?
Yeah, there's definitely a bit of both. I would say it's definitely a lot more pros than cons in today's world, but there's definitely a little bit of both depending on the organization and how they manage their internal logistics. Sometimes there are, excuse me, there are opportunities where it's more effective or just there's not a need to maybe overcomplicate a process with technology, right? And I think we have to understand what some of those things are within an organization. You want to make sure you don't make someone's life more difficult by moving them to something that might be unnecessary. On the flip side, there are opportunities and where you have obligations in order to provide information, especially with a lot of external organizations, whether it be mostly in this case is the insurance companies, it could be CMS related stuff, it could be compliance related information, and then you have to interact with these organizations, and that piece tends to be a real heavy burden on the staff, especially if they're doing it in a manual fashion. As an example, right, one of the things when we built out the platform, an average physician works with 20 to 25 different health plans. So if you're going to be in business in a certain state and you're going to provide services to a set of your patients, your panels, and you want to move through those enrollment processes with all the payers and your credentialing and everything else, the amount of effort it takes for an administrator or an individual in the organization to go to every single payer, provide the same information or an additional piece of information, work that process forward, it's extremely laborious, it's extremely redundant. And this is where we think the technology makes a huge difference, right? So if you're managing your provider population in a centralized platform where you can, all the relevant information about that physician is there or your group of physicians, then you, the administrator, can go in and they can, in the way the system is organized, you can see all the different payers that you want to interact with, literally check the box of the different things you want to do. Let the system do the heavy lifting. Let them use its technology and its smarts and its AI to understand what it needs to be delivered to who, where, what, the right time and place. If there's something missing, make sure it's added before it's sent off, because those are the things that really create a lengthy process. And when that happens, it inhibits really the ability for the practice to see patients, right? And one of two things happens: either they're enrolling or being in business to see patients for the first time as a practice, or maybe it's a new location, or et cetera, or they're extending or re-enrolling, their contract has expired, and if they miss those deadlines, most insurance companies require you to kind of restart the process. So now you're talking about potentially months of time in order to go through that process. And every day that you lose, I think there's a lot of data out there in the market. On an average day, it equates about $10,000 in lost patient revenue for the practice, right? So it adds up pretty quick, right? So you want to be able to make sure that you're tracking it efficiently, removing some of that stress from the organization, and then be able to enable that going forward.
So, you brought up some really excellent points, and, thinking about the pros and cons of automation, one of the pros is security and privacy, right? And just kind of thinking about your past experiences, could you maybe shed some light on, an opportunity that automation lended to improved security?
Yeah, there's a lot of good examples there. Because of just my own background, I before Madaket and some places before that, I spent a lot of time in the interoperability and data management space. So I spent a lot of time working around security and patient data and sharing that, right? So there's a lot of different angles there. But from this perspective, right, most organizations that are still largely manual or paper-based, their information is somewhat scattered, right? So you have a combination of files on desks or in drawers in multiple locations. You have some information on laptops, desktops, and then you have some information that might be sitting in a cloud somewhere. And what we tend to find is it's not treated with the same level of heightened security that, say, patient information is, right? And what happens then is it tends to be attached accidentally with other things that go out the door. We see it all the time. They'll send us data files on something, and there's some information there that shouldn't be there, right? So we want to make sure that opportunity removes itself by using the system, or a system, any system, where the information is contained. There's real security protocols in place, and you're securely moving that information from wherever it needs to go from your organization to the other. So I think that those are some of the examples there.
Absolutely. And I think you mentioned something else when you were talking, and I smiled a little bit when you said it. You said, if they're failing to get their credentialing done on time, there are chances that they're going to miss those deadlines, and then they're going to have to refile, and then they can't see the patient. And what the reason I smiled is because most cases, those providers are going to continue to see the patient anyway.
True.
And so then what happens is this significant challenge to the revenue cycle, right?
Hmm.
Because we're not able to collect like we think we ought to be able to collect,
Yep.
and sometimes even identifying that that issue has occurred is a big challenge. And then we're also creating this huge amount of patient abrasion because, right, that we've seen the patient now, and we're sending them maybe 90 days later a large bill and say, hey, we talked to your insurance and we tried to appeal it for you, but they're not going to pay it. And then the patient's like, well, I called my insurance and they said, you're not an eligible provider. Why didn't you tell me that before I was seen? Right. So it causes kind of all these
Yeah.
trickle down issues. So when we're talking about using automation to sort of remove some of these hurdles, that seems like a small component, but it really can have big implications, right?
It can have huge implications. And to your point, most providers are not going to suspend service because most will assume that it's a short delay, right? And that's always the
Right.
misstep. We'll say it that way. It's not often a short delay, and what happens is they're holding their charges, or they're holding their claims submissions, thinking, okay, a week or two later I'll drop them. We're all good,
Right.
and then it's 2 or 3 months later, and they haven't been
And
able to get them out the door. And now all the things you just mentioned
mhm.
are starting to pop up, and then now there's a lot of abrasion between all three entities: the patient, the insurance company, and then the physician who provided the service, saying, hey, I should be able to be reimbursed for this. You shouldn't be charging the patient. You end up in a very lengthy round and round discussion at that point.
Oh, yeah. And I mean, and then you're trying to get retroactive claims payment,
Hmm.
which not all payers are even going to do to begin with, you
Correct.
know. That in and of itself is a challenge. So
Hmm.
I guess, thinking of things like that can cause all these big pain points, what are kind of some of your top tips for reducing administrative burden through the use of technological automation? Because to your earlier point, it's so easy to actually overcomplicate a process
Hmm.
with automation, right? And even just like patient chart alerts is a great example of, taking technology and using it in a way that now it's a detriment. So what are kind of some of your top tips for how we can implement automation?
So I think there's a couple of key things here, but I think moving your disparate information, especially if it's largely paper based or in random files, into a centralized location, right? Get into a central store of data so you can be able to track it, see it across your organization. Everyone sees the same information. If it gets updated once. Not sure which location we updated and which one we didn't. Right? Make it more simplistic. One that'll help you have much more cleaner, better, useful information. From that step forward, it makes a lot of other things more simplistic, right? So if I want to provide a roster to CMS or to one of my payers, I can go from there. If I update that roster once, it's already there until I update something else, and I'll have to worry about all the other locations. And then it starts to minimize the amount of extra work that has to go on going forward. And then over time, it just gets the iterations on that, make it more simplistic, better data, to the point where the system, depending on the system you're using, can largely manage that information to a point without a whole lot of user intervention. And it will also at that point remind you if there's an event coming up. Your contract with a particular payer in your state is going to expire in 90 days, and it's going to expire in 60 days, and it's going to expire in 30 days, right? So it's telling you over and over again, hey, we got to get on this, so you don't reach that point where we just talked about where you fall out of compliance and it becomes a bigger challenge.
Great advice. Oh my gosh, thanks so much for that. Um, you know, Turning our attention to resource sharing with our audience. Taya and I, as Taya mentioned, we've kind of been on a little hiatus, reading the Federal Register, getting updated on the CPT changes for 2023, ICD changes for 2023, other policies that are impacting healthcare organizations. We like to kind of turn to certain resources, right? And we both love to read. We co-authored a revenue cycle management book, and we absolutely love to read. We make sure that we block time in our schedules to do that. We love to
And we
hear
read
from
fun things too.
we
Okay.
do. Yeah,
We're
yes,
not just these
absolutely.
lame-o policy wonks. I mean, we are, but we also read fun stuff too. Okay.
Well, hopefully you're reading something more exciting than the Federal Register.
Hey, the Federal Register is super exciting to me. But yeah, we do.
We do. But thinking about, where you go to get information, could you share, some of the places that you turn to get information? But then also, because we love to read, could you share maybe your favorite book with our audience as well?
Sure. Yeah. I'm kind of a sponge when it comes to information. There's not really one place that I turn to all the time. I love to go to, different domains within healthcare that I know are tried and true and push a lot of information forward. We've all been to a lot of those before, and I intentionally move around to see what different viewpoints are there, so I can kind of formulate my own thoughts on the information that's being put out in the market. And sometimes I provide my commentary on that to the market, and I think that's something we all do, right, collectively, because we've been around the market for a long time and we have a lot of information. We should be able to share that information and add some value to others. But for myself, like removing myself kind of from maybe the healthcare space for a second, I'm as a leader of a business, I'm always trying to understand how we can be better at our business, how I can be better at my business. So I've kind of gravitated over time towards, a few books by Chris Voss I really like, or like the negotiation side, art of negotiation. But really the one I've always keep on my desk is Never Split the Difference by Chris Voss, and really talking about, um, you know, how to make sure you're putting you and your business and your organization in the best spot possible. And also make sure that whoever you're dealing with feels as though they've won or had a successful encounter with you as well, right? So there's a lot of cool tips in there. There's a good way to engage both internally in your organization and externally with clients and others out there. So I recommend, if you haven't seen it, check out Never Split the Difference.
I don't think I have read that one yet, so it's going on my list.
Yeah, Chris Voss was one of the most senior negotiator at the CIA for a long time.
Wow. I will check it out. I'll tell you, one of my favorite books for team collaboration is A Hitchhiker's Guide to the Galaxy.
That's a good one.
Yeah, I don't know if you've
Yeah,
ever read it, but I mean, that
I
is
have.
all about what happens when you have a lack of communication and transparency. They go into language barriers. There's all kinds of great stuff in there. Yeah, it's fantasy, but great one. But I'll check that
Yeah,
out. Never Split the Difference.
Yeah.
yeah,
I think what you said about making sure that each encounter is a successful one for both parties. That kind of
yeah.
ties back to automation, right? So it's really all about how we
Yeah.
implement automation. The last thing that we want to do is bottleneck a healthcare provider's workflow with automation. So we really want to make sure that we're implementing it in a sensible way that's sustainable for the organization, that increases the quality of care, and then overall, make sure that our workforce is happy, and our workforce includes our providers. So Eric, it's been a
There we
pleasure.
go.
Thank you so much for being with us. And we love to make sure that our audience, we've lovingly call them RevDivers, that they get access to incredible thought leaders like yourself. We have a lot of really good content that's coming up. So until we meet again, Rev Divers, keep diving into those Rev cycles.